28 to 9. Now, Euromonitor International's 2019 Global Health and Nutrition Survey finds that consumers are looking at health with a more holistic view. People are no longer only interested in looking good, but are highly focused on feeling good as well. The study has found 39% of South African respondents say they're experiencing stress and anxiety. Well, to tell us more about some of the key findings, we're joined via Skype from London by Amrutha Shridhar, a consumer insights research consultant. Amrutha, good morning, and thank you very much for your time. It looks like mental well-being is top of the list in terms of the trends that your study has found.
Yeah, definitely. So this is a global trend that we're seeing, but it's also specifically to South Africa as well. Like you mentioned, healthy living has often focused on physical ailments and appearance. However, over the past couple of years, we've kind of noticed that there's a dramatic shift to mental well-being, with most global respondents and around 73 of South African respondents saying that being healthy includes mental well-being. And this kind of goes along with that holistic view that we're seeing that people are taking when it comes to their healthcare as well. So they're looking at changing their diet, they're looking at meditating, they're looking at doing yoga, looking to calm themselves, as well as take vitamins and supplements, maybe have a gluten-free diet or a raw foods diet, alongside normal pharmaceutical drugs as well. So it's really a holistic view that people are taking and living a balanced lifestyle and having that kind of preventative healthcare initiative from the get-go.
And physical fitness, exercise is still very much part of that holistic approach to being well?
Definitely, definitely. We're seeing so many people actually viewing exercising as being trendy. Being fit and being healthy and taking care of yourself is a huge trend that's happening at the moment globally and in South Africa as well. And when we're looking at exercise, we're also looking at sports nutrition, and a lot of South Africans are actually looking at getting their sports nutrition to enhance that exercise lifestyle, to make sure that they're actively supporting their body to do those exercises as well.
Now, you mentioned that in terms of the study, there's a high number of South Africans who are currently experiencing stress and anxiety. Any indication in this survey, in this study, what's causing that stress and anxiety among South Africans?
Well, we have various different other surveys. So we have a lifestyle survey as well. So when we look at both of those combined, we can see that there is specific areas in terms of environmental stresses, family stresses, as well as political and economic stresses and financial stresses. So these are just your everyday kind of stresses that people are having. And when we're looking at the stress and anxiety levels of South Africans in particular, the impact to their lifestyles is from low to moderate. So it's not at a severe or extreme stress levels. It's basically just the daily grind of every day that people are experiencing, and they want to kind of alleviate and make sure that they have that calmer mindset in order to have that holistic well-being as well.
Where did you find extreme stress levels? By comparison, I mean, who's really suffering under pressure, so to speak? Which countries?
When we're looking at the countries of extreme stress, we're looking at usually the US, China, Japan, and some of the North African countries as well. So these people are usually claimed to be quite overworked or have a lot of financial, economic, and political stresses as well. So when we look at the survey data, these are the respondents that selected that they were suffering from more high to extreme levels of stress.
Yeah, I mean, as you know, we are in our winter here. Just ahead of winter, we're always told prevention is better than cure. Take the flu jab, take some vitamins. Did you find that there's a trend among this holistic approach of emphasizing more prevention than treatment?
Definitely. So we see that specifically in vitamins and supplements, as well as in the exercise habits. So the reasons that people are taking those vitamins and supplements or exercising more is that preventative area of healthcare. So kind of getting ahead of any kind of illnesses or ailments that people might be having in the future by taking multivitamins or vitamin C or calcium in order to prevent any further healthcare issues. And alongside that as well, it's also the cost of healthcare. So being preventative is much more cost effective than in the future having something that you might need to spend a lot of money on in order to heal or cure.
Lots of interesting consumer insights. I'm sure if you were a brand, you'll be saying, yeah, I need to change my approach in this space of health and well-being. Thank you very much. That's Amrutha Shridhar, a consumer insights research consultant on the line. That was via Skype from London, just giving us a little bit more on the key trends highlighted in the latest Euromonitor International's 2019 Health and Nutrition Survey.